Hey guys, Dr. Childs here. Today we're going to be talking about losing weight on levothyroxine. If you don't already know, levothyroxine is the most commonly prescribed thyroid medication on the market, and we have a ton of thyroid patients who have weight gain secondary to low thyroid, right? That's one of the most common symptoms that patients with low thyroid function present with. And yet, we also have a huge number of patients who are being treated, right, with levothyroxine who are not losing weight. So we're going to dive into that story. We're going to talk about what happens, what you should expect when losing levothyroxine, how it impacts your weight, what other options are available to you as a thyroid patient, including thyroid medications that are more effective. And lastly, we'll be talking about who really does well on T4 only medications like levothyroxine. If you don't know me, I'm Dr. Childs. I'm an internist and I specialize in helping people with thyroid problems, helping people with hormone imbalances, and of course, helping people lose weight. But today is really about the thyroid, and specifically it's about thyroid medication known as levothyroxine. So let's talk about that. Now, as I mentioned before, a lot of thyroid patients kind of assume that once they fix their thyroid, they're going to lose weight, right? Because it makes sense. If low thyroid causes weight gain, then fixing that thyroid should cause weight loss, right? Well, you would think so, but it doesn't actually work out that way. And I'm going to explain to you kind of why that is, and we'll be talking about it sort of as we go through this thing. But let's talk about that first of all. So why aren't you losing weight if you're taking levothyroxine? So I have 4 reasons here, and I'm going to go over each one of them. And I want you to ask these questions to yourself kind of as we go through them. So the first question is it right for you? And what I really mean is, what I really mean here is levothyroxine the right medication for your body and for your specific situation? Now, when it comes to thyroid management by your doctor, it's really not an individual approach. It's really a cookie cutter type of a treatment paradigm. And what I mean by that is everyone gets the same treatment, regardless of age, regardless of medical conditions, you name it, right? It doesn't really matter. No matter what, if you have low thyroid, you're getting put on levothyroxine. But what may surprise you is that there are a ton of other thyroid medications. In fact, last I counted, I think it was like 8 to 10, something like that. So really everyone's getting one medicine when there are 6 to 8 more different or various types of thyroid medications on the market. So you should be aware of that. Is it the right medication for you? It may very well be the case that it is not the right case for you, or that is not the right medication for you, and there are other options which would be far better for you. And we'll talk about some of these as we go in just a minute here. So that's number 1. Then number 2 is, what if it is the right medication for you, but have you waited long enough? All right. Now, this is something that I really want thyroid patients to understand, and that is whenever you treat thyroid function, and this includes with supplements, this includes with medications, etc., it takes a long time for whatever you do to sort of take effect in the thyroid and in the body. In fact, that's probably around 4 to 6 weeks. Okay? Weeks here. Let me put that here so you guys can see it. So we're talking 4 to 6 weeks whenever you make a single change. You won't even see the impact for that amount of time later. Okay, so imagine you start taking thyroid medication and you're only 7 days, 10 days, 14 days into it, and you're sitting there sort of impatiently wondering why you haven't lost any weight. It could just be a matter of time, okay? Now, to complicate this a little bit further, you have to understand as well that this is how long it takes to see a change based off whatever dose you're taking, but most of the time the dose isn't correct right away, okay? So you can multiply this by 3 to 4 times or however many times you need to adjust your dose. So your doctor will make a change, like let's say put you on 100 micrograms of T4, then you have to wait 4 to 6 weeks to see if that's right for you. It may be too much, it may not be enough. Then they'll make another change, right? Then they'll increase it. Let's say increase it to 125. Then you have to wait another 3 to 4 weeks. So you can see what I mean. It actually takes quite a while. I would say most patients don't even get dialed in on the right dose for them, if they do at all, for probably 6 to 12 months, okay? So time is really an important factor here when you're talking about whether or not it's going to work for you. The next question is, are you taking enough? And this really comes back to what I was just explaining here. If it very well could be the case that levothyroxine is right for you, and perhaps you have waited long enough in this situation, but perhaps you're not taking enough of it, right? So it could very well be the case that your doctor put you on 100 micrograms and your TSH went from, let's say, 5.2 and it dropped down to something like 3.6, and it's improved, but it's not all the way there yet. So it could very well be the case that you just simply need more of that medication. Now, again, it's kind of hard to determine, are you somebody who needs to just wait longer and to adjust your dose, or is it simply not right for you, as we mentioned in the beginning? So you kind of have to play that one by ear, and that's why you need to take an individualized approach to each person. And then the last thing I want you to ask is, do you think that the thyroid medication you're taking, in this case levothyroxine, is actually getting into your system? Is it being absorbed by the body? Now, you probably know this because your pharmacist has probably told you this, but when you pick up your thyroid medication, it has a whole list of instructions on how to take it correctly. And I find a ton of thyroid patients are just simply not taking it correctly. They take it with food, they take it with coffee, they take it first thing in the morning, they take it with supplements. All of these things can interfere how well or how much is actually getting into your body. If you take it correctly and you're taking the right dose, it can make a huge difference in terms of how you're feeling. In fact, simply changing what time of day you take your levothyroxine can make a big difference by itself. So you have to think about it. Is it actually getting into your system? I'll create a video just specifically on this topic because there's probably 8 to 10 things that you should be aware of as a thyroid patient. But I want you to at least ask yourself that. It very well could be the case that it's right for you. You're on the right dose. You've waited long enough. But because you're taking it, let's say with coffee or something like that, it's just not getting into your system. And if you just made that one little tweak, boom, there you go. Your thyroid function will increase, your metabolism will go up, and all of a sudden now you're losing weight. So think about that. Okay, so let's talk for a second about levothyroxine versus other thyroid medications. So if you remember in the beginning, I sort of talked about it and I said there's a lot of different types of thyroid medication. So I want to come back to that and explain what I meant. So there are broadly speaking, there are two different types of thyroid hormone that you can be prescribed. There are other thyroid hormones available, in fact, some available over the counter, like T2. But when it comes to prescription medications, there are two types. And there are the types that are T4 and the types that are T3. And what that means is these medications contain those hormones. Now, T4, medications that contain T4, including, by the way, levothyroxine. Levothyroxine is a medication which contains only T4. These medications are not as powerful as medications which contain T3. And that is because T4 is not available to be used right away by the body. It requires an extra step to turn into T3. So a lot of people have trouble turning it into T3. A lot of people simply aren't taking enough dose, etc. But what I want you to understand here is that if you take a medication which contains T3, you don't have to worry about that activation process, okay? You're taking the medication that's the most powerful and you're getting it right into the body, you're getting it right into your cells, and it's doing the job that you want. Okay, so when it comes to weight loss, for most people, medications which contain T3 or at least a component of T3 or T3 only are far more effective at weight loss than those that contain T4 like levothyroxine. So let me give you some examples so this sort of makes a little more sense. So medications like NDT, that includes Armour Thyroid or Nature Thyroid, etc., they have some T3 in them. Therefore, they are often going to be better than levothyroxine at helping patients lose weight. Another example would be Cytomel. Okay, Cytomel is a T3 only medication, and it is, again, far more effective at helping patients lose weight because it contains pure T3. It doesn't even have any T4. Armour Thyroid and NDT, they have mostly T4 actually, and some T3 in there as well. So I want you to understand that concept. But just because T3, generally speaking, tends to be more effective for weight loss, doesn't mean you can't lose weight on T4 only, like levothyroxine, Synthroid, Tirosint, etc. So I've had plenty of patients who have taken these medications, done very well, lost weight on them. You know, they don't have to add T3 or NDT to the mix there, but I want you to understand the distinction between these two types of prescription medications that are available to you as a thyroid patient. Okay, so lastly, what I want to touch on would be people who tend to do best on T4. So how do you know if you're somebody who should just give levothyroxine more time, or if you should change, you know, how you're taking it to see if it gets into your system a little bit better, or what time of day you're taking it, etc. So this is sort of a rough list of all the people in my experience that I've seen who tend to do pretty well on levothyroxine just right off the bat. So I have this list of those people who are, and we'll talk about these one by one. The first would be those who are treatment naive. And really what I mean by that is just people who haven't used thyroid medication, period, in the past ever, right? So these patients are people who haven't tried anything else. If you are somebody who has tried already Synthroid, levothyroxine, et cetera, and isn't working for you, well, guess what? It's probably not going to work for you if you try it again the third or the fourth or the fifth time, okay? Even though doctors will do that to you, believe it or not. So if you haven't tried anything for the first time, it's usually best to start with levothyroxine simply because it's easily tolerated by the body. There's far fewer side effects. It just allows you to sort of get into thyroid hormone management, you know, a lot easier. So if you haven't had any treatment, those people tend to do better on levothyroxine and it helping with weight loss and so on. Another group of people who tend to do better on levothyroxine would be those who are sensitive to medications which contain T3. So you'll know who I'm talking about if you're listening to this. I'm talking about people who have tried even low doses of NDT like Armour Thyroid or liothyronine or Cytomel, and they just don't respond well to it. They feel jittery, they feel anxious, their heart rate, you know, goes through the roof, they have heart palpitations, etc. There are lots of people who simply just cannot tolerate any thyroid medication with T3 due to how sensitive their body is to it. Okay, so if that's you, then you're going to have to use T4 only medications by virtue of the fact that you can't tolerate the other ones, right? The next group of people would be anyone who is sensitive in general to medications and supplements. I'm talking all types of medications, all types of supplements. Now, I've had the opportunity to treat a lot of patients in this category. And again, you know who you are if you're listening to this. I'm talking about people who, take the recommended dose of Tylenol or ibuprofen and it's just way too much for them. Or somebody who takes one capsule of Benadryl and it gives them energy instead of, calming them down and helping them sleep at night or, fixing a runny nose or whatever it is. So these are people that just tend to be really sensitive to all types of medication. Remember what I said before, T4, like levothyroxine, that tends to be better tolerated by the body. It requires that extra activation in the step by the body. So this just seems to be a more mild version of thyroid hormone. So if you're sensitive to T3 or you're sensitive in general to medications and supplements, this will probably be the best place for you to start. Doesn't mean you can't add those later, but starting there tends to be best. Okay, another group of people who do best on levothyroxine would be those people who also don't have other chronic illnesses. Okay, so I'm talking about things like other autoimmune diseases. So let's say you have Hashimoto's thyroiditis. You also have vitiligo. You have high cholesterol. You have high blood pressure. You're 30 pounds overweight or whatever it is. Those all stack on top of each other. And each chronic illness that you have makes it more likely that T4 is not going to work for you. Okay, so put in another term. Let me rephrase that. The more sicknesses or illnesses you have, the less likely levothyroxine is to help you with weight loss. Okay. The more likely you are to need that T3 and that Cytomel to get to your weight loss goals, because all of those illnesses impact that conversion process, right? All of those things stack on top of each other and make it much less likely that your body will take that T4 and activate it into T3. So that's another group of people. And then another group of people who tend to do well on T4 are those people who are seeing pretty immediate results with it, okay? So remember I said in the beginning it takes about 4 to 6 weeks to see improvement. That is true generally, but some people, a fair, I would say maybe 10, 15, 20% of people who start thyroid medication see at least some improvement much quicker than this. So if you are somebody who, let's say, started levothyroxine and you're starting to see improvements in how you feel in just 2 to 3 weeks or 2 to 4 weeks, that's a really good sign, right? That means that your body is able to use it, it's activating it, and so on. But if you've been on it for, let's say, 3, 4, 5 months and haven't noticed a single thing, that's a bad sign, right? That means that regardless of probably how you tweak your dose, what time of day you take it, and so on, it's probably not going to have the desired effect that you're looking for. So how sensitive you are to feeling improvement on it and how quickly that those improvements come is another good, valuable tool that you can use to determine if it is right for you. And that's the list of people that I would say, if you fit on this category or into any of these categories, you should consider using levothyroxine over these other medications. It's easier to get, it's a little safer to use in terms of side effects, and so on. It's a little more mild as well. So start with these. And I want to hear from you guys as well. Now, are you seeing any weight loss on levothyroxine? In fact, have you seen weight gain? I have an entire video that talks about how levothyroxine can actually contribute to weight gain, and it has to do with this conversion process as well. So have you lost weight on levothyroxine? Are you gaining weight on levothyroxine, or have you noticed no difference? Let me know and kind of tell me a little bit about your story below. And if you haven't already, make sure that you download my free thyroid PDF resources. I have tons of information, tons of resources, all like this, designed to help thyroid patients like you feel better. That's sort of my goal here. So leave your questions below, and otherwise I will see you guys in the next one.